Good morning, guys. Welcome back to my channel. It's Brittany here, aka Empowered Para, and on today's video I am going to throw it back to 3 whole years ago when I thought I was going to start my YouTube channel, and I interviewed my friend Theresa about being pregnant when you're paralyzed. In this video I talked to her all about the issues that come up in the first trimester of pregnancy that are unique to being paralyzed and pregnant. I also share my own experiences with being pregnant and talk about the issues that I had in my first trimester. And I say at the end of the video that I am going to follow her throughout her pregnancy and talk about the second and third trimester issues in different videos, but I didn't. So I will do videos on that after Christmas, just on my own, talking about the second and third trimester issues. And then I will also do a video about labor and delivery when you're paralyzed. So you can stay tuned for that. But for today's video, it's just going to be this super old video that I took with my friend, and you'll get to see me with super short hair and glasses, which when I look back seems super funny. But I hope you enjoy the video. If you have any questions for either me or my friend Theresa, please leave me a comment and I will be sure to answer them as best I can or pass them on to her. I also have another friend that just had a baby, so if you have questions that I can't answer, I can ask her as well. So she might have more information or be able to remember more than I can, because my kids are kind of getting old now. So coming up, me and my friend Theresa, all about pregnancy when you're paralyzed in the first trimester. Hope you like it.
Hey everyone, and welcome to my video series on spinal cord injury and pregnancy in women. Today will be the first of many interviews with my friend Theresa as we follow her throughout her pregnancy and talk about some of the challenges that women with spinal cord injuries face. Theresa and I met back in 2014 when she was pregnant with her first child, and she was searching for resources and information on parenting with a disability. She reached out to our local Spinal Cord Injury Association, and luckily enough I had just finished doing a YouTube video with them on some of the successes that I had found with my own 2 children, and so they were able to connect us in that way. In the years since we've met, we've become pretty close friends, and Theresa has found her own success in parenting from her wheelchair. Theresa's daughter is now 3.5 years old, and she is currently pregnant with her second child, and she has graciously agreed to let me follow her pregnancy as we talk about some of the issues that can come up for women with spinal cord injuries. In this first video, we're going to touch on just a little bit about herself, sort of what her feelings were when she first found out she was pregnant for the very first time, and then some first trimester issues. So without further ado, how about you tell us a little bit about yourself, including how you were injured?
Okay. Well, I had my spinal cord injury back in 1997, so that was 20 years ago now. And it was from a fluke tobogganing injury that left me a complete T12L1 paraplegic. I was in a chair for quite a long time before I was really in a relationship where I was contemplating actually going ahead and getting pregnant and having a baby. So I think all of those years in a chair helped me to get comfortable with my disability and kind of have a really good handle on all of that, so that I was ready to take on parenthood as a woman with a spinal cord injury. In 2014, I got married to my now husband and moved to Edmonton, and we started the process of building an accessible house, and we thought, well, we really wanted to have children. We always thought maybe 1 or 2. Let's have 1 and see how it goes. And then if we thought we could take it on, possibly a second one. And so we thought, well, you know, maybe it'll take a while to get pregnant, so let's just start kind of trying now and see what happens. But we didn't think I would actually get pregnant till after the house was built and all of that. But it turned out as soon as we started building the house, we actually, I think our very first month of trying, we got pregnant. So when we got pregnant right away, it really reinforced that, wow, my body, even though there's parts of it I can't feel and that don't move, it still kind of knows how to work on its own, and my fertility really wasn't any different.
Yeah. So that leads me to my next question. Your first reaction, sort of when you found out you were pregnant, do you think you had any different emotions than you would have as an able-bodied woman, or do you think, you know, being in a chair really doesn't change the surprise, the nervousness, or anything like that? What's your opinion on that?
Well, that's a good question. It's hard to separate my disability from anything because it's so like integrated into the way I think now. I think that it was mostly a similar experience as someone without a disability. The shock and surprise of it all, like, oh my gosh, this is really happening.
Yeah.
Like, we're really going to have a child, and all of everything that comes with that. So I'm sure in many ways it's a very similar feeling looking at that pregnancy test and seeing, you know, that it's positive. But I think also I had some probably extra worries, like you would have with the first child, because, you know, maybe we don't know someone else with a spinal cord injury who's gone through it, so we don't have, there's not as much information out there and other people that we can talk to find out, okay, you know, what's this experience going to be like? How am I going to do everything as a parent? Like, how am I going to do some of the simple things that able-bodied parents can do, lifting a child up off the ground, you know, nursing a baby, doing all those the physical component of being a parent. What's that going to look like for me? Am I going to need some kind of like special aids to help me do certain things?
Right.
Or am I going to find a way to do them without aids? Like, so there's a lot of extra questions and I guess worries. I think that we might feel in addition to what an able-bodied mom or would feel. So I think most of the feelings are probably the same, but I would say probably we have some extra worries. I mean, that's just what I think.
I think that's a good summary. And I think your point about, you know, everybody sort of looks around to see like, what is my life going to be like after I have a baby? And there's just so much less examples or so much less, you know, media, propaganda, whatever there is that we get to draw from out in the world. You know, we go to the, you know, Toys R Us, we can't see any pictures or setups that look like it might work for us. So I think you're right in that sense where, you know, we try and sort of decide how our life is going to be, but we can't really draw as many examples that will sort of allow us to see what that might look like. So, okay, so now we're gonna switch gears a little bit and talk about the first trimester issues that come up. And really, there's a whole bunch of issues in the first trimester of pregnancy, but the unique ones to spinal cord injury sort of fall in three categories. The first one I think is medication, the second one is urinary tract infections, and then the third one is sort of blood clots. These are all first trimester issues that tend to come up within the first visit to the obstetrician. So talking about medication, most women in chairs are on some sort of medication, whether it be baclofen or some sort of antispasmodic for spasticity in their legs, probably something for bladder control, because we do intermittent catheterization, and then some people are on other medications for pain or neuropathic pain, that kind of stuff. So can you tell me about your experience with having to either stop medications or take extra medications, any of those things with your pregnancies?
Okay. Well, with my first pregnancy, because I think I'd been in a chair so long, I had spent a lot of time on those medications after my spinal cord injury, And then I had lots of time to do some trial and error in stopping a lot of those medications and trying to, through say, drinking more water and through diet, come up with ways that I could maybe get off a lot of those medications. So actually, by the time we started thinking about pregnancy, I had been for already a number of years off of all of those medications, luckily. So that was actually something that didn't come up for me, which I guess, yeah, you're right, would be rare for someone with a spinal cord injury to not have to deal with that. But yeah, so there was nothing I had to go off of. So yeah, I was lucky in that, I guess.
I know for myself, I take both baclofen and oxybutynin, baclofen being an antispasmodic for my legs, spasticity in my legs, and then the oxybutynin is a bladder antispasmodic. So when I was pregnant with my first child, the physiatrist actually informed me that because I was on such a high dose, especially of baclofen, and it's such a slow process to wean off of this medication, that it wouldn't really be realistic for me to come off of my medications, because by the time I was basically weaned off of the baclofen to a dose that would be still therapeutic, the pregnancy would basically have been over. So for myself, I stayed on the maximum dosage of baclofen and the maximum dosage of oxybutynin, and so those are both category C medications, but they didn't actually have any effects on my children other than like a small withdrawal period when they were born. So I know that was my experience, but yeah, everybody's different, and it's so nice to hear some women at least don't have to go through that whole withdrawal experience, because it can be a long one and it can really, you know, be painful or uncomfortable, that kind of thing. So that's really great that you were able to do that process before.
Well, yeah, but also like a lot of women with spinal cord injuries have the spasms like you have. I think the majority of people with spinal cord injuries do have spasms, and I don't have spasms.
Right.
So that was one that I never had to be on. I also was fortunate in that I didn't have any pain that came along with my spinal cord injury. So I think in a couple ways, I just, there were a couple issues that say a lot of people with spinal cord injuries, what leads them to have to be on certain medications. I didn't have to be on those. But yeah, it did make it a little bit easier, the transition to pregnancy that way.
Yeah, for sure. I think that at least when there's one big category that can be eliminated, that's always nice.
Yeah.
So the next thing that can come up in the first trimester of pregnancy is urinary tract infections. Women with spinal cord injuries, this is nothing really new, but when you are pregnant, sometimes it just makes it a whole lot worse. And because urinary tract infections can be a cause of preterm labor, they are sort of regarded as a major issue in pregnancy, and they have to sort of be dealt with in different ways. So can you tell me about your experience with that, and sort of what if you had any UTIs, what was done about them?
Yeah, okay, so well, I think it was around 2006, I made a big change where I started drinking a lot more water. Like, I think I went to drinking like 12 glasses of water a day, and started doing my in and out cathing a lot more frequently, like every 2 to 2.5 hours. And when I made that change, I stopped kind of having many problems with UTIs. I'd only get like only the rare one. So by the time I got pregnant with Reese, my daughter, I was not really having a problem with them. But as soon as I got pregnant with her, it was UTI after UTI after UTI. And so after treating the first 3 or 4 separately, my OBGYN put me on a low-dose antibiotic for the rest of the pregnancy just to prevent them. Because as you mentioned, preterm labor can be very serious. And so that got me through that pregnancy. As soon as I got pregnant this time around, I got a UTI again. And we treated that one with antibiotics, and then I, for some reason, haven't had any more issues with it. And so I guess for whatever reason, I've been a little bit luckier this time, so I haven't had to go on the medication full time.
Oh, well, that's awesome. Again, I'll just share a little bit about my experience. I know that I had chronic UTI with my second child, and the obstetrician that I had at the time didn't really think it was as serious an issue as it really is. And so I had multiple separate UTIs over the course of my entire pregnancy, and by the time I saw a different obstetrician, just by chance because mine was on holiday, that actually put me on the low dose preventative sort of antibiotic. It was sort of too late, and I believe that my chronic UTI had something to do with my daughter being born premature, so she was 5 weeks premature. So yes, it can be a huge issue, and definitely needs to be one that's addressed early on. And if the obstetrician is not addressing it adequately, you really need to advocate for yourself and do the research on, you know, what needs to be done with spinal cord injury and UTI, especially when you're pregnant. So
yeah, I agree, and it's that just highlights the importance of getting more information out there about spinal cord injury and pregnancy, so that women can do their own research. Because I think often when we get pregnant, we look to the doctor to kind of tell us what to do, and the doctors we're dealing with, in probably most cases, have not dealt with another woman with a spinal cord injury who's pregnant, so they may not, you know the gravity of UTIs and seriousness of UTIs for us in our population, and particularly with pregnancy. So they may not automatically know that let's just put them on the macrobid or whatever it is, and just help mitigate some of these issues right from the get-go.
Yeah, exactly. Yeah, so I'm glad that you haven't had that many issues with this pregnancy. That's another good news story. So the last issue that comes up typically within the first trimester is the issue of blood clots. So people with spinal cord injuries, men and women alike, are at a higher risk for blood clots just in general, and then pregnancy makes that even worse. So sometimes doctors will want to put us on a blood thinner or worry about that closer to the delivery of the baby, but it's really case by case basis, and I find a lot of doctors don't really have like a standard practice for what goes on, but it's definitely an issue. So I wanted to ask you sort of what your experience has been with this sort of issue.
Well, my OBGYN considered it for quite a while through my first pregnancy.
Considered the blood thinners?
Whether or not to put me on blood thinners, and at what point to put me on them. I believe someone on her team had been an obstetrician for a woman with a spinal cord injury before, but I don't think she herself had experience with it. So she was doing a lot of research and trying to find the best solution. Blood thinners come with their own risks, I believe, and also involve giving yourself an injection every day, and they're very, very expensive if you don't have healthcare coverage for them. And so there's, she wanted to really look into it before putting me on them. And what we came to was, because I didn't have a history of blood clots, and because I'm a pretty active individual, she thought we should just bypass that and that I should just wear compression stockings. So through the second half of my pregnancy with Reese, I was wearing compression stockings every day, and that's all I really did in the way of preventing blood clots. And I didn't have any issues, so that went well. This time around, with this pregnancy, we decided the same thing, no blood thinners. but I happened to have broken my knee 2 weeks ago. So I've got an extra risk involved this time with a broken limb that's healing. And extra swelling and all of that, I guess, can increase your chances of getting a blood clot again. So I've got, I'm paraplegic, that increases your risk. I'm pregnant, that increases your risk, and now I have a broken leg. So my orthopedic surgeon wanted me to do something extra to reduce my risks. And so what he decided was to put me, to put these, I'm not actually sure what they're called. I should go look that. It's called Venopro. That's what it is. Venopro. It's a new product. It's kind of like if you've ever been in the hospital, like say after your spinal cord injury. Yeah. When you're on bed rest for a long time, they'll put these big, kind of like pneumatic, air-filled things on your legs, and they kind of pump up. But they're electric, they need to be plugged in, so it's not feasible for me. I'm moving around all the time right now. So they've come up with a new solution for that. It's a similar product, but it just goes around your calf. Oh. And it's battery powered. Okay. So he wanted me to wear those and wear it underneath my brace. So I've got a few layers on. I have like compression stockings, then I've got this Venopro thing, and then I've got my brace. So I guess we're hoping that that's providing some extra blood flow through my legs. And your calf is the most common place to get a blood clot. So I guess what we're trying to do is just kind of reduce my risks by doing that.
That's really cool. I will make sure I provide a link to some information about the Venopro, Venopro, so that people can check that out, and then also take some pictures of it as well. That's really it for the first trimester issues. Thanks again for letting me follow you around during your pregnancy, and that's really it for this first video. If there's anything else you guys think I missed, maybe leave some comments or send me an email, and stay tuned for our next video.
Alright guys, that was the video. I hope you liked it. Again, if you have any questions, please leave me a comment and I will be sure to try and answer them as best I can, or I will pass them on to my friends who have more recently had babies. That's it for today, guys. Please stay tuned after Christmas for all of the other videos I do about pregnancy when you're paralyzed. And stay tuned for next week when I post the video that I've been working on all about how I was hurt. Thanks for watching, guys. Have a good day. Bye-bye.